A dural fistula is a vascular anomaly that can be present usually in relationship to the lining of the brain or the spinal cord. And that's why it's called dura, because dura is the name that we use for this membrane that covers the brain and the spinal cord. It is basically an abnormal communication between an artery and a vein, which happens at the earliest stage that normally, in the sense that high pressure blood can enter the vein, and that will create an unstable situation. They are lesions that are found often incidentally as well when patients are imaged for other reasons. They can give symptoms, and of course they can bleed. The common presentation for dural fistulae is usually tinnitus or hearing problems. Patients have difficulties with this, and they are investigated, and you can see them because one of the common locations is near the area of the inner ear. Dural fistulae are subdivided in subcategories depending on the way that the veins out of the fistula point are distributed on the brain. This is very important for people that want to deal with them because it decides how dangerous they are. If a fistula is draining on a vein outside the actual brain surface, then the risk of bleeding or the risk of significant problems is reduced or very low. If a fistula has veins that are draining on the surface of the brain, then these are the high-risk fistula that needs to be dealt with as reasonably early as possible because they are the high risk of causing a bleed. And when we're talking about bleeds, they are a type of strokes, obviously, which can cause from minor to very severe problems. Fistulae, of course, are diagnosed or suspected by the standard imaging that we do, most commonly MRI, but they can be seen on CT scans. But the gold standard is obviously a digital subtraction angiography or an angiogram, which is an invasive procedure requiring a little tube to be threaded into the vessels with dye injected into it. It is an important way of, it is a vital way of doing this, even though there are some risks involved when people have this invasive procedure, because it is the only way we can actually identify the fistula properly and then make a decision on how to treat it. The way that fistula present are usually in adult life. So there is, of course, there are some very rare conditions that appear in children, but the majority are acquired lesions that happen sometime in adult life. We don't know exactly why. There is, of course, some evidence that a trauma can cause them, but this is a small number of them. The majority are spontaneous, some sort of degenerative condition that can cause them. One subcategory of the dural fistulae, the spinal dural fistulae, is becoming more and more evident over the last few years because it has been recognized more as a problem that in the past was ignored. It affects older individuals who present with difficulties walking, with difficulties using their legs, as well as having problems with their bladder. And they are considered that in the past they were thought to be just old age, but when they are investigated properly, these degenerative fistulae are identified in their spine, which is causing swelling of the spinal cord and problems. The way to find them is to have a proper neurological opinion where people can be appropriately assessed, examined, and have the appropriate imaging, which usually an MRI scan again, which will demonstrate the fistula. After that, more investigations, of course, are necessary where they can demonstrate the fistula properly and decisions for treatment, which could at least protect people from this condition.